I remember exactly where I was. I remember seeing a phone call come in and it said like 216 Cleveland.
And I answered and I remember my heart was beating really quickly.
It was Dr. Warren that called me.
She asked me like, oh, are you still considering us for medical school? I was like, absolutely.
Getting that phone call quite literally changed my life.
And I think I just kept going, oh my gosh, oh my gosh.
Oh my gosh, no, thank you.
And yeah, I think I cried. No, I cried actually.
Yes, this is the best news. Yes, thank you so much.
So starting right after we got to Cleveland with the white coat ceremony, being presented with a long white coat really set the tone for the rest of our years here in med school.
Everyone had done such incredible things, like been Rhodes Scholars or done amazing research.
And I just remember being like, wow, these are cool people.
And you do have a little bit of imposter syndrome, like, do I actually belong here? But as you go through, you're really motivated by them.
They're so brilliant and smart and curious and driven, but also funny and kind and compassionate and clever and people you would want to spend a 6-hour car ride with.
It was still very much full of COVID patients and we were all gowned up with like the huge masks and everything.
We went to class in masks all the time. The way that they were handling COVID here seemed to make a lot of sense.
I love the early exposure to clinic starting M1.
Having that patient experience early, complementing what you're learning in the classroom is really helpful.
Not having the burden of testing kind of gave me freedom to learn medicine the way that I wanted to learn it.
The Cleveland Clinic sees a lot of rare cases that you don't see anywhere else.
It was a nurturing environment, personalized feedback, in the midst of being at a huge hospital with great opportunities.
With lectures, you're getting a lot of information and you're not necessarily processing it properly. So with PBL, you're actually actively thinking and working through a patient case as you would do on the wards.
There are things that I still remember from PBL that have stuck with me just because that's the method that you're learning it is through patient-based and problem-based learning. You're also tasked with teaching something to your peers. That means you learn it really in depth.
The best thing anyone could ever do for you is give you feedback, to see your potential and see how good you are and say, you know, if you did this one thing, I think you could be even better and I think you could achieve your goals.
They're giving me practical tips immediately after. That works best for me.
The first day of the first year of medical school, if you just cold emailed someone and said, hey, so-and-so, I'd love to shadow you, you get a response in a couple days, they're excited to work with you.
Faculty are incredible here.
I've been just so impressed by their availability. Most of them are world leaders in their fields, but when they're approached by a CCLCM student, they're always willing to teach or have you involved in their lab. As people who are interested in research, we want to educate our field and our colleagues as well.
The emphasis on research in combination with clinical care is so unique and different than any other medical school.
My research was primarily focused on looking at ophthalmic imaging and seeing if we can assess a patient's cardiovascular risk status based on those images alone.
I did a year of research studying rheumatic heart disease and degenerative mitral valve disease.
This leads to a very interesting question of could we stop cancer-directed therapy for some patients and have them still continue on with good outcomes?
And our hypothesis was that higher NT-proBNP levels measured at the time of LVF recovery are independently associated with higher risk of LVF relapse and adverse clinical outcomes.
The benefit was most pronounced in those who had moderate to severe hydronephrosis.
What I learned is the hardest and the most beautiful part of research is our answer is really another question of like, we should look at this more.
And I think a lot of us had these conversations openly about how important it was to us to give back to the local community. So I was very involved in Haven Home, which is a shelter for women and children who are experiencing homelessness.
And we were bringing health screenings, hypertension and blood pressures, as well as diabetes screenings.
So we have a project here called the Bolton Elementary Outreach Project. Me and a lot of my peers worked together on creating this supplemental health and hygiene curriculum and then tried to create an interactive activity as well.
I think I'll remember my classmates and the way that it felt to be a part of this community. I feel so honored and lucky to learn beside them and to call them friends, and each of us are going to go into medicine and make a difference, and that is just one of the best feelings. That's really what I will take away is the community that's here.
I think just seeing them achieve such great things motivated me to do the same.
I'd come here 10 times out of 10. Absolutely would do it again.
I'm really excited for match day because I'm excited to see where everyone's gonna go.
I was just saying, I remember in my first and second year watching upper class students go through this whole process and thinking, wow, that looks stressful. And now here we are, and it sure is.
Incredibly surreal for me. Yeah, I can't even believe I'm here.
I feel like I was able to learn so much medicine and be surrounded by really good people who have been able to fill my cup over the past 5 years.
We had opportunities here we would never have had anywhere else.
We are wired to not like uncertainty, and this is uncertain. Like, I do not know what is on the inside of that envelope.
The place you match today will not define you. It's going to be you and your new co-residents that will help to define it. So congratulations, class of 2026.
To Duke for urology. I'm very excited. My #1 choice. Internal medicine programs. I'm going to Hopkins. Very excited.
At Brigham and Women's Hospital. I'm very excited. Internal medicine. So I'm all good.
I matched in plastic surgery at the Cleveland Clinic. Super excited.
#1 choice, Cleveland Clinic. Get to stay home. Super excited.
I'm really thrilled with the match. Harvard and Boston. Ophthalmology. It's a dream come true for sure.
Very well, ophthalmology here at Cleveland Clinic, so super excited to stay.
Going to Cornell for urology. I'm excited, yeah.
I'm going to Stanford, interventional radiology.
I matched ophthalmology at Harvard, Mass Pioneer. Absolutely incredible, and I have all the credit to give to CCLCM.
Matched to MGH for internal medicine, which was my #1. Very excited.
Doing psychiatry at Mass General McLean.
I'm really excited.
We're going to Mayo! Internal medicine.
Urology.
I matched ophthalmology at Cleveland Clinic. So excited.
I matched internal medicine at Penn, my alma mater. I'm so excited.
Got my first choice. I'm doing family medicine at Emory University. I'm very excited.
I'm going to Boston, my top choice program at Harvard, emergency medicine. I'm pretty stoked, yeah.
I'm thrilled. Cincinnati, med-peds. I'm very excited.
Great, Miami, dermatology.
I did well. I matched on my #1 Stanford, general surgery. I'm very excited.
I'm really happy. I'm going Boston, obstetrics and gynecology.